The milkman who conquered smallpox. The cowpox pustules on Sarah Nelmez's hand glistened with pus as Dr. Edward Jenner drew the infected matter into a lancet on the morning of May 14, 1796, preparing to perform history's first vaccination on an 8-year-old boy. In the cramped parlor of his Berkeley cottage, Jenner laid out his surgical instruments on a wooden table while young James Fipps sat wide-eyed in his mother's lap. The room smelled of carbolic soap and anxiety as Jenner explained his radical theory that cowpox infection could protect against the far deadlier smallpox that killed 400,000 Europeans annually. Sarah Nelmez, a local milkmaid with fresh cowpox lesions on her hands from infected cattle, had volunteered to be the source of Jenner's experimental material. Her occupation had given her natural immunity to smallpox, a folk observation that dairy workers rarely contracted the disease that scarred or killed their neighbors. Jenner made 2 shallow cuts in James's arm with the contaminated lancet, then rubbed the cowpox matter into the wounds. The boy whimpered as the yellowish fluid entered his bloodstream, carrying with it either protection or death. Jenner couldn't be certain which. For 8 days, James developed a mild fever and small lesions at the inoculation sites, then recovered completely. The real test came on July 1st, when Jenner deliberately exposed James to fresh smallpox material taken from an active case. The boy remained healthy. Jenner repeated the exposure multiple times over the following months, each time watching anxiously for the telltale fever and pustules that meant smallpox infection. James showed no symptoms. A milkmaid's occupational disease had somehow taught the boy's body to recognize and defeat humanity's most feared killer. Word of Jenner's vaccination, from the Latin vacca meaning cow, spread through medical circles with the speed of scandal. The Royal Society rejected his initial paper as too revolutionary, too dependent on a single case study. Critics mocked the idea that cowpox could prevent human disease, publishing satirical cartoons showing people sprouting cow horns after Jenner's treatment. Religious leaders denounced vaccination as interference with divine will. If God intended smallpox to kill, human intervention was blasphemy. But Jenner's technique worked. Within a decade, vaccination programs across Europe were dramatically reducing smallpox mortality. Napoleon had his entire army vaccinated, calling Jenner one of the greatest benefactors of mankind. The practice spread globally, carried by ship surgeons and colonial doctors who recognized its life-saving potential. James Fipps lived to age 65, never contracting smallpox despite multiple exposures throughout his life. In 1980, the World Health Organization declared smallpox the first human disease eradicated through vaccination, a victory that began with cowpox pustules on a milkmaid's hand and a country doctor willing to bet a child's life on a folk remedy. The ultimate irony. Humanity's greatest medical triumph emerged not from laboratory research, but from the simple observation that people who worked with cows didn't die of smallpox, proving that sometimes the most profound scientific breakthroughs hide in plain sight.